Well, joining me now is the Shadow Health Secretary, Andy Burnham. Andy Burnham, first of all, there was a lot in your speech, but the central idea is that public provision is at the heart of the health service. You said, and I repeat, Labour calls time the Tory market experiment to the NHS. I am clear the market is not the answer to 21st century health and care. Last week, a minister in your department, Liz Kendall, said there remains a role for private and voluntary where they can add capacity to the NHS or challenge the system, and indeed what matters is what works. Which is it?
Well, I said myself today that there's still a role for private and voluntary providers, but I also did say very clearly that the market is not the answer. Why is it not the answer? Because the market delivers fragmentation of care, and the future demands the opposite. It demands integration of care. We need to free up the NHS to integrate, to partner, to merge, so that it can make services, change services and make them affordable in this very difficult outlook that we face.
So what is the right percentage of outsourcing then?
Well, there isn't a right percentage. I'm very clear that the NHS should be our preferred provider. So I don't see a role for the private sector where it can replace core public provision at the heart of every community. But there's a supporting role where extra capacity is needed, as Liz Kendall said, to bring down waiting lists. That's where they can play a part.
Let's be clear. You would like the NHS to do less outsourcing than they do now?
Yes, I believe in the public NHS and what it represents. And do you know, Kirsty, I'm not going to be apologetic about that. I believe in a service that puts people before profits. And that's what I believe is why the public trusts the NHS today in the way that they do.
Well, let's just have a look at that graph there that was in Chris Cook's film again, because it looks at outsourcing. And what it says is that the vast majority of outsourcing that was done 4.4%. In the last Labour government. There's only less than 2% has happened in the last 4 years. So do you want it back at 4.4%, or was that a mistake?
Let me explain that graph, if I may, because what happened was, in the early years of the last government, we brought in private sector capacity to bring down waiting lists.
Was that a mistake?
No, it wasn't, because I wanted waiting lists to come down. Everybody did. But the policy then began to change towards the end of the last government, where there was a version, let me answer the question, of any willing provider. When I came in as Health Secretary, to show you that these aren't easy words from opposition, I thought that was going too far, because it may, destabilise NHS provision. We've just had a situation in West Sussex in the last couple of days where Bupa has pulled out because it was clear that if they had carried on and taken a service out of that hospital, it would have destabilised, it would have destabilised the public hospital. So
you want to see less of a percentage. Now, is it a good idea that the NHS to do things right in the way that it gives the best outcome to patients? Is that the most important thing?
Of course. The policy I've launched today is to put the patient, the person, at the centre of care, to start in the home and to integrate there. And actually, to be honest, the big reform I've made today is not about the market, it's actually about integration. It's about bringing health and social care together so that we can build one team around the person in the home. And the thing about markets, Kirsty, is they bring more players onto the pitch.
Yes, but
they increase the complexity of care.
They bring players onto the pitch.
And they intensify the frustration the public feel telling the same story to everybody who comes through the door.
Let's just look at, for example, let's take a GP and he's got a patient that needs treatment and he's got two choices. And one choice is the public provision, other choice is outsourcing. And she makes the decision that the outsourcing is best for the outcome of that patient. Is their GP to be allowed to do that or not?
The GP's got to be able to make the best decision for the patient.
So if that means outsourcing, it means outsourcing.
I've said to you at the very start of this interview, I said to you very clearly, so I'm not sure why you're saying this, that there is a role for the private and the voluntary sector. But if you listen to what I'm saying, I'm saying it's a supporting role, not a replacement role. And it's not so hard to understand that,
It is hard to understand, because here's the thing. We did a study and we looked at knees and hips across a number of patients. And the ones that were outsourced had a better quality of care, they felt, and a better outcome. So therefore, that matters to people. That matters to people who pay into the National Health Service to know that they have the opportunity, if necessary, to go to the best place for them. What you seem to be suggesting is, it's not a question of replacing, it's giving them that possibility of provision. And that's what you want to take away.
No, I'm saying to you that there's a new reality now from the last decade. The new reality is times are very tough, and market-based provision of healthcare adds cost, and it adds complexity, and it brings fragmentation. So I'm saying to you, of course we support choice, and of course we support
clinicians. But you don't support entire choice.
Of course we support clinicians getting the best for their patients. But that is within the context of a public NHS, where the NHS is the preferred provider. Because if you carry on stripping services out, cherry picking, you in the end destabilise, wait a second, NHS provision. And that is exactly what has happened in West Sussex yesterday, where the logic of the coalition's reforms have threatened to destabilise an NHS hospital.
What I want to know is what a Labour
government had to pull out of that deal.
So what would a Labour government, if it's not about replacement, and it's about hips, it's about knees, which you seem to be suggesting is still OK to do in an outsourcing location.
I'm not sure what you're not understanding.
Well,
there's a role, but if you let it go too far,
so
it destabilises the public NHS.
What is it too far? Is too far varicose veins? Is too far hernias? Is too far chemotherapy?
Too far is the graph that you showed there, where the Coalition's Health and Social Care Act...
it was 1.5% more than you.
No, it was continuing to increase through the Coalition years, and it's ramping up now
I think what the voters want to know...
Well, if you're not letting me answer questions, let me answer a question and I'll tell you.
You have made a statement that you think that the time for Tory experimentation in the market is over. You made that statement in your speech. I want to know how far you're going to take that. And what I'd like to know is what operations can and cannot be done by outsourcing under a Labour government. I mean, Tony Blair once said that 40% of operations could possibly be done by outsourcing. I'm asking you, if people have trouble getting varicose veins dealt with, have trouble with hernias, and actually even maybe chemotherapy, then is it all right if it's the best...
I'm not sure you want to hear me make my point. You seem to want to...
I want to ask you.
To ask you to speak at length yourself. I'm making a very clear statement to you that the NHS and clinicians have always been able to use the private sector, always actually, to purchase the care that they think is best for their patients. That's always been the case. What I'm saying to you is the Health and Social Care Act 2012, the Coalition's reform that nobody gave them permission to bring forward, has put an alien ideology at the heart of the NHS, and that is to put all services out to the market. And that goes against the grain of the NHS ethos, and actually it begins to undermine public NHS organisations. And that, for me, is beyond the limits of where the market should be, because it starts to fragment and destabilise services, and that is beginning to happen right now.
You've just said all services. Actually, outsourcing is 6% of the NHS.
Yeah, but it's increasing every year because all services have to be put out. So as they're coming up for renewal, CCGs are having to put services out to the market. So what level would you suggest? 2%, 1%, 0.5%? What do you want to see? Because you know what? Voters are concerned about politicising the NHS, and they want clarity. If you are making statements like, you know, it's rising and nearly 6% is too much, people want a straight answer and they want to know what percentage you would accept. Well, I've given clarity today. I've said very clearly that the NHS, the public NHS, is the preferred provider. And do you know what? I believe... I believe, if you let me answer a question, that the public support that.
A number.
The public support the idea of a service that puts people before profits. I'm not going to put a number.
Well, is it less than 6%?
No, because
is it less than 4.4%?
I've said to you, there is a role for the private and the voluntary sector, and that's a decision at local level. If the public NHS needs support to bring down waiting lists, to add services that aren't available through local hospitals, that is a decision to be taken at local level. I'm not putting a target on saying that's the right level. What I am saying to you is that this government is taking the private sector right into the heart of the NHS, and nobody has ever given this Prime Minister or this government permission to put their NHS up for sale.
If a local health board cannot get its varicose vein operations through without going to an outside provider in quite a big way, and maybe takes it over percentage-wise, 6%, as far as you're concerned, the outcome is more important, so therefore that's OK.
Well, I don't think you've been listening to what I've been saying.
Oh, I have.
I've said to you very clearly at the very beginning of this interview that there is a role, but it's within the context of the NHS as preferred provider. If they choose to use other providers, voluntary or private, to help and support the public NHS, that's fine, a supporting role. What I do not support is a replacement role, but that is what the Coalition has put the NHS on a path towards greater privatisation and fragmentation.
Andy Burnham, thank you very much.